Welcome to the show, everyone. I'm JJ Flizanes, your empowerment strategist and producer. Thank you for downloading today's episode. Today, we have back Dr. William Davis with his newest book, Super Gut. And we recorded this a few months ago, and I've been holding on to it because I won't lie, this opened up a whole new can of worms for me. And some of it I'm still dealing with. So it has led to a lot of research. It's led to tests. It's led to a lot of questions, trial and error. And I look forward to bringing you more on this topic of gut and gut health and bloating and SIBO and SIFO and food allergies. We're going to talk a lot more about this in the near future. I'm still in it as we speak right now, but this started the conversation down a much more intense road, so to speak. So I hope you enjoy today's information. As you know, Dr. William Davis is the author of the New York Times #1 bestseller, Wheat Belly, Lose the Wheat, Lose the Weight, and Find Your Path Back to Health. He also wrote Undoctored. We talked about that on the show. And his most recent book, Super Gut, Reprogram Your Microbiome to Restore Health, Lose Weight, and Turn Back the Clock. He's got a new website where everything comes together. It's drdavisinfinitehealth.com. Be sure to check that out. And as I mentioned on the show, he's also got his own podcast called Defiant Health. So I don't think he needs any more introduction than that. If you've been listening for a while, this is our 4th episode together. 2 of them were on his books, Wheat Belly and Undoctored. One of them, he interviewed me on Defiant Health, and I re-aired that on this show. And now we're together for the 4th time. I hope you learn and get inspired and curious, and will stay for the conversation with me as we continue past this into all kinds of topics surrounding gut health, bloating, food sensitivities, all the things. So enjoy today's episode. Welcome back, everybody. Guess who's back? Dr. William Davis. He's got a new book out called Super Gut, and we're going to get into the power of the microbiome today. If you are finding us on YouTube, know that I'm a empowerment strategist and a producer, which means I'm going to talk. I'm going to have a conversation. However, I will probably talk less on this episode than I have in previous episodes with Dr. Davis, because this book is chock full of stuff I just want him to share with us, but I will ask questions. But if you don't like me, which is totally cool, you can find more about Dr. Davis, where we're going to go to drdavisinfinitehealth.com. Is that correct?
Mm-hmm.
Okay. He also has a podcast, Defiant Health. He do a YouTube channel?
Yes. I don't recall what it's called.
All right. So search Dr. Davis, Dr. William Davis in your search bar on YouTube and find his YouTube channel. Okay. So if you don't like me, totally cool. Go find him. Otherwise, stay along for the ride. If you're listening to this on the podcast, as you probably already guessed, we do have a video. So come on over to jjflizanes.tv if you want to see us talk about, and there might be some show and tell. I mean, I'm showing the book right now, but I don't know if there's anything else we can show and tell. But without further ado, congratulations on Super Gut.
Well, thank you, JJ.
And there's just, I feel like this book is a crash course in a lot of science that people may or may not be ready for. And I don't mean that in a negative way. I mean, it's like you get this book and you're going to have to be with this book. And it's so chock full of the information. It's a step up from like the how to do it yourself kind of, even though you give a 4-week program in the back of the book on how to create a super gut and heal your gut. But I want to bring it down to some very basic understanding. On this show, I talk a lot about, and I bring other doctors and nutritionists and people on to talk about all kinds of things that have to do with immunity and gut. And when I look at the world and I see what I think everybody has, which is some kind of gut issue based on environment and how our food has changed, right? And then, of course, as you know, there's a whole emotional component, because anxiety and stress absolutely ends up twisting and turning and disrupting the natural flow of digestion. But there are some terms that you've mentioned on the past shows that we've done, like SIBO and SIFO, and we kind of got into it and we kind of didn't. And then there's like, well, what's the difference between leaky gut, SIBO, and SIFO? So I'd like to start there to just set the tone so people can be clear about when they're thinking about their gut health and how to go about it, how to get tests done, how to proceed, what to do. What if they have all 3? Can you have all 3? Can you have 1? So where do you want to start? Which one do you want to tackle first?
Let me start with SIBO, because I think it all starts with SIBO, or at least dysbiosis. So I would define dysbiosis as a disruption of the composition of species in the colon. But unfortunately, in so many people, really conservatively estimated a third of the country. I think that's too conservative as time goes on. But 100 million people, probably among the biggest epidemics ever in the history of mankind. But and so in dysbiosis, unhealthy species have proliferated. These are stool species for the most part. Well, in SIBO, small intestinal bacterial overgrowth, those same stool species have then ascended up to 24 feet of small bowel, the ileum, jejunum, duodenum, and stomach. Now, these microbes don't last for decades. They only last for minutes to hours. And so trillions of microbes in 30 feet total of GI tract living and dying in rapid succession. When they die, a lot of their breakdown products, particularly from their cell walls, gain entry into the bloodstream. That's so-called leaky gut or endotoxemia. And that can be measured. You can actually measure the endotoxins called lipopolysaccharide or LPS. It's not clinically available, unfortunately, it's still a research tool, but you can measure whether somebody has oodles of this bacterial breakdown product in your bloodstream. And it's much more of an issue in SIBO because the colon, where microbes are supposed to be, has a very thick, durable 2-layer mucus barrier. The small bowel has a much more fragile, thin, single-layer mucus barrier. So when microbes have proliferated into the small bowel, they're much better able to breach that barrier, inflame the intestinal wall, and their breakdown products gain entry in the bloodstream. But this is the process. SIBO, dysbiosis, then SIBO, and endotoxemia that explains how and why microbes in the GI tract can be experienced as rosacea or psoriasis in the skin, or as muscle aches and pain of fibromyalgia, or as depression, or Lou Gehrig's disease, or Alzheimer's dementia in the brain, or as joints pain and swelling of rheumatoid arthritis. In other words, JJ, I think all human disease needs to be reconsidered, redefined in light of this incredibly important discovery made by a Belgian group in 2007.
I was reaching for, because you talked about testing. So I do have another show and tell because I still haven't used this yet. Is this what's going to get me to test whether I have SIBO?
So it's one way to identify whether this is true or not. Think of it as a mapping device. So all it does is detects, I don't know if you have the new one. The old one was only measured hydrogen gas. The new one measures hydrogen gas and methane. These are bacterial products. And so it's all about, so humans don't produce hydrogen gas. So if you're producing hydrogen gas in the breath, and it shows up on your smartphone, it tells you you've got bacteria. But we all have bacteria. So it has to do with the timing. So what we do with this air device is we kind of do what they do in formal H2 testing, hydrogen testing. We take a baseline level. There's a prep to do this first, and that's all detailed.
Which is why I haven't done it, because I'm like, okay, I try to set it up. I'm like, okay, hold on. I need to know how to do this like properly. And so I just didn't do it. And then I haven't done it and I want to do it. So let's get me to like do this by the end of this recording today.
Well, it's fairly straightforward. The 12 hours prior to, you want to eat only things that have no fiber or sugars. So it's essentially meats and green leafy vegetables, but no legumes, no starches, nothing, because you don't want to feed your bacteria. So do that for about 12 hours ahead of time, and then do a baseline level. It talks to your phone, and your baseline level should be low. Let's say 1.2. It's 0 to 10. And then you consume something that bacteria eat, such as inulin. 2 teaspoons of inulin is an easy thing to do in your coffee or tea or something. You can eat other foods too, by the way, but you want to get the 2 teaspoons of prebiotic fiber, such as inulin. And then test every 30 to 45 minutes for 90 minutes. And if you see a rise of 4 units or more, it tells you bacteria high up in the GI tract. In other words, if you didn't have SIBO, you can take that fiber and it shouldn't register a positive for a minimum of 90 minutes because it takes that long to get through the 24 feet of small bowel. Some people it takes 7-8 hours. But 90 minutes is as soon as it should do that. So let's say 1.2, you get your inulin, and at 45 minutes, you've got a 9.7. You've got it. Bacteria are living way up high in your stomach and duodenum and jejunum. The problem with this device, it's a wonderful device. The problem is it's helpful when it's positive. if it's negative, you can still have SIBO. That's confusing. The reason for that is, one, we're only using one kind of prebiotic fiber. Not all species are identified by that. Also, not all species produce hydrogen gas. So the way to untangle that is if you say you test it and you're positive, okay, you got SIBO, got to deal with it. But let's say you test it and it's negative, 1.2, 2.1, 1.9, whatever. But you have bloating, you've got an eczema rash, you've got anxiety attacks, panic attacks. You have telltale signs. Maybe you have fat droplets in the toilet, fat malabsorption. Maybe you have fibromyalgia, which is virtually synonymous with SIBO, or irritable bowel syndrome, virtually synonymous with SIBO. Even if you test negative, I would say the likelihood you have SIBO is so high that I would still embark on a process. So why bother with the testing? Well, it's still useful, because if you're confirmed a positive, it's reassuring, one, and you can use it to track. You put yourself on whatever program you do, and rather than 9.8, maybe a month later you test negative. So it can be useful, but it's not perfect. This is, by the way, it's as good as or better than the test you get in a doctor's office or clinic. So it's not like this is a second best. No, this is as good as or better than the doctor's version.
Okay, I'm still going to wind us back because I know people are going, okay, whoa, since you're telling me I probably have this, I probably need to do something about it anyway. And I still want to go back and see is like, how did we get SIBO?
Good question. All the factors probably have not been identified. I suspect there are unidentified factors, but we do know that the oodles of antibiotics that people have taken, so it's not uncommon that by age 40, most of us have taken 30 courses of antibiotics, and you don't recover from antibiotics. You lose species, they don't come back. How about antibiotic residues in food, herbicide, pesticide residues in food, glyphosate, the active ingredient in Roundup herbicide, is also an antibiotic. Food additives, emulsifying agents, synthetic sweeteners. In other words, many drugs, anti-inflammatory drugs like ibuprofen, naproxen, stomach acid blocking drugs, statin, cholesterol drugs. So virtually everybody's been exposed to one, if not dozens of factors that disrupt stress, obesity. That alone is enough to disrupt the microbiome. And so it's widespread. In fact, I would argue that everybody, at the very least, has dysbiosis, that has disrupted species in the colon. And I think a growing number, and I think a minimum 100 million people, 1 in 3 Americans, have the SIBO version, and another many millions of people have SIFO, small intestinal fungal overgrowth also. That documented as SIBO, but I think it's a big problem.
Years ago, I was seeing a medical intuitive, and she had a good number of modalities of medicine or food, or like she seemed to sort of be up to date with what was going on. And even to me, things I hadn't heard before. And one of the things that she did say was about that most people have some kind of fungus or bacteria going in their body. And there was a product called Mold X. And I think she gave it to Doug. He had some things on my partner, on his, like on his skin, like he had some, and I'm convinced, everyone on the show probably knows by now, I'm convinced, and I know that one of my cats probably also has a mold overgrowth. And I haven't tested it because in the veterinary world, I don't know that I can test it, but I'm pretty sure that has been there. But I do now have some things I can do about it finally. But looking at this level, and so I guess that's really where I want to like sort of hit this point hard for people who are listening to this, because it is hard. It is easy to get caught up in the doctor speak of like, oh, these conditions. And then I stop thinking because I'm just going to ask you. And it's like, okay, let's pull back for a second, everybody. So the reality of it is everyone on the planet has been introduced to herbicides and pesticides. Even there's, and we talk about this on a different show with Dr. Chris, where, you can have one side of the farm that's organic and the other side that's not. And then the wind blows over from one end to the other. And now we're still cross-pollinating, things that are happening. And so we can't really outrun it. we can do our best, which is why, detoxification, changing the diet, and all the different things that we do to sort of keep up with it, because we can't outrun it. We can change it. Education will help us be aware and ask for things. That's why we pay more money for organic, because we really want to make sure that it didn't come into contact with some of these poisons that are supposed to kill bugs. And yet we didn't think about what they would do to us when we ate them. So because you have been exposed to this, you can just assume, like Dr. Davis said, 1 in 3 people on the planet probably has dysbiosis and SIBO, which means you have bacteria that doesn't belong in your body growing. That's not good bacteria. It's bad bacteria. Yes.
Mm-hmm.
To say it very simply. Okay. And then does SIBO or SIFO turn into leaky gut? Is that how we start? Does it start with dysbiosis into SIBO, or does it start with and then into leaky gut? Because leaky gut ultimately would be the perforation of the lining of the walls that allow particles into the bloodstream, which then the body reacts by sending white blood cells to attack the particles that are unknown, plus try to fix the damaged tissue. So now your body is in constant non-productive inflammatory response, which causes a whole myriad of other things, correct?
Mm-hmm. SIBO is definitely associated with leaky gut or endotoxemia. What's not clear is, can you just have dysbiosis confined to the colon? That is proliferation of unhealthy species like E. coli and Klebsiella. But they're in the colon, where there's a 2-layer mucus barrier, and it's not as readily breached as in the small bowel. So it's not clear. The science has not been performed yet to determine whether there's leaky gut or endotoxemia with dysbiosis alone. I suspect that there is, but it's not as bad. It's really a small bowel issue because of that thinner mucus barrier, and because the small bowel is 24 feet long and the colon is only about 4 or 5 feet long. So just the sheer volume of microbes that can get up to the small bowel. And JJ, these are stool microbes. It kind of freaks people out to know that, but it's E. coli and Shigella and Sam. You might recognize some of these names also as the microbes of food poisoning. But these are stool microbes. And that's why I call my radiologist colleagues call this fecalization, because when they do a CAT scan and people swallow contrast to see the inner contours of the GI tract, stool in the colon has a very specific appearance. Well, now they're seeing stool in the small bowel, so-called fecalization. So that's why chapter in Supergut is called The Fecalization of America. They're seeing it at an alarming rate. So this is everywhere. This process is everywhere. Here's the problem. Some people will say, as you touched on, they'll say, oh, this is too much to worry about. Scary. It's complicated. I don't want to do it. Well, you're going to pay a big health price if you just sadly, go to John Q Primary Care. And he's going to say, there's nothing wrong with you. You're nuts. Did you consult Dr. Google? There's no such thing. Even though the science is overwhelming, telling us, oh yeah, this is a real thing. You go to the gastroenterologist and they have no qualms about saying, JJ, you need an endoscopy and a colonoscopy. Ka-ching, ka-ching, ka-ching. They perform the tests, charge you and your insurance company thousands of dollars, and say, good news, you don't have stomach cancer, no colon cancer, goodbye. You said, but I came here about a question about SIBO because I have fibromyalgia or bowel syndrome or diarrhea, whatever. There's nothing wrong with you. I didn't see anything. At the very most, they might prescribe an antibiotic. That's uncommon, like rifaximin, but never tell you how you got it, never tell you how to keep it from coming back, because it comes back as a rule. And so they're not doing their job. But that's why I wrote the Undoctored book. My colleagues are not doing their stinking job, because all they're interested in is dispensing pharmaceuticals and procedures to generate revenues. Healthcare has nothing to do with health. So here's an instance, dysbiosis and SIBO, where people really can and must take the reins of their own health. I got off topic on that, but
I'm with you, and everybody on the show by now knows that. Undoctored. I mean, we've done all the books now, and talked about that. And Undoctored. A lot of people from my community bought Undoctored and were reading it and are reading it because, again, within the environment that we're in right now, hopefully one day soon, the sky will part and people will have clear vision about what's going on right now. Have you, by the way, side note, have you seen the Hulu show called Dope Sick?
I've seen part of it. Very disturbing.
It's happening now. And that's why I can't understand how people are watching this and not making the connection of what's going on right freaking now. But anyway, as I digress, Dope Sick, everybody, Hulu, Dope Sick. So, all right, I still want to go back because I am a science person, and because it's so natural to you and you understand all of it so well, I just keep wanting to go back to like the simple brain, and mine isn't necessarily simple, but I'm sure other people are like, what? Huh? So I'm like, okay, dysbiosis is having disruption of the gut by these. We'll go back to give me the what dysbiosis is again.
So this is a bit of an oversimplification, but it's a very neat, simple way to think of it. So think of dysbiosis as a change in bowel flora species in the colon, the large bowel. But
okay,
SIBO,
but based on what's normal, but wouldn't you say that none of us have normal? I mean, what's normal? Who on the planet would have what is considered normal?
That's a very essential question. So nobody really knows what eubiosis looks like. But here's a question that I don't have an answer. Nobody has an answer to. What if we look at the remaining populations of humans who've not taken antibiotics, who don't take Lipitor, who don't take ibuprofen, who don't get emulsifiers in their ice cream, all the things we've done? Well, there are several populations, the Yanomami in the Brazilian rainforest, the Matsas in the highlands of Peru, the Maasai in Kenya, the Malawi people in Eastern Africa. There's a bunch of these populations, and they've had their bowel flora studied. What's interesting about these people who live on different continents and don't talk to each other, don't come in contact with each other, is their bowel flora is very different from ours, and they're all very similar to each other. And that's been interpreted to mean they have Stone Age microbiome. They have the microbiome we're supposed to have, but we've lost. And it's completely different. They have species we don't have. We have species they don't have. They have much more diversity. And so what's not clear, maybe some of the adaptations we have in the microbiome composition are adaptive. Maybe they're positive, but a lot of them are clearly negative. The problem is no one knows. This comes up when people have fecal transplants, where typically for C. diff. So Clostridium difficile is this microbe that overpopulates after a course of antibiotics. You take a course of ciprofloxacin, say, for a urinary tract infection or something, and then you've got diarrhea, which often happens, but it won't stop. And it gets bloody, and you start to have abdominal pain. And they find this organism, Clostridium difficile, because when you remove healthy organisms, it allows these other bad guys to proliferate. And then you have to take multiple courses of antibiotics. It recurs. It often doesn't respond. You can die of it. So it's a big, big, big problem. I lost my train of thought.
No, because I took you down that don't we all have dysbiosis? And so if we start with everyone, just assume you have dysbiosis, and we don't, and because we are not going to get back to where those other indigenous people are who don't know each other, whose gut looks like Stone Age guts in terms of their flora. Let's just assume we all are off, and then it becomes a problem or something. It's a problem, but it's more of a problem, I guess, when we're having symptoms like you just mentioned, all the fibromyalgia, joint pain, all the symptoms that don't bring you back into balance. And no one can tell you that it's anything else, but like you've done all the tests and you don't know what it is and you haven't figured it out. And so we're going to go to, rather than go waste your time on all the other tests and seeing all the doctors that you just mentioned who are not going to tell you anything of value, why not just jump ahead and start looking at the gut? Okay, so we're looking at the gut and we know that you're off. We're all off. So how off are you, and how do I test how bad it is? And how do I start to reverse that? And again, my brain still wants to go to everyone has dysbiosis. Okay, we all have an unnatural gut flora, whether we have more bad guys and less good guys. Some of us may have a 50-50. Okay, but nonetheless, there's stuff in there that shouldn't be in there. Now, how do the stool microbes get in? Is again, it like the idea of leaky gut, where things that aren't digestible or can't break down perforate the walls, which then create basically holes. So talk about how the stool microbes get back there. Like how's that coming in?
You're getting into an area, JJ, that's not well explored yet. It's called translocation. That is, let's say you have SIBO, 30 feet, trillions of microbes, and they release their components and they enter the bloodstream, endotoxemia, leaky gut. And that drives inflammation and insulin resistance. And that what that means is you're much more prone to high blood pressure, coronary disease, atrial fibrillation, dementia, cancers, neurodegenerative disorders. So that's all driven by this endotoxemia process. But you're raising a different question, which is, what about the microbes that actually penetrate, breach the intestinal barrier, and gain entry into the bloodstream and other organs? That is becoming clear. This happens a lot. One of the biggest risk factors for colon cancer, for instance, is a microbe in your mouth. And it's been mapped out. How did that microbe from the mouth gain entry to the colon to cause cancer? It was swallowing, right? No. If you mark those bacteria, like with a radioactive marker or something, it gets to the colon through the bloodstream, and vice versa. So think of the intestine as a semi-permeable membrane. It allows things in, allows things out. And that's a big discovery, because it means that's why intestinal processes can be expressed in other parts of the body. But a lot of the details are not worked out. For instance, when a woman has recurrent candida vaginitis, for instance, one of the ways you can manage it is to take Lactobacillus reuteri, RC14 strain, and it populates the vaginal canal. Now, how did it get there? There's no connection. The vagina is not connected to the GI tract. Or is it because they're contiguous near each other? Or is it because blood-borne seeding so that there's a lot of unanswered questions here, but the arrows are pointing towards the blood being the means by which microbes from the intestine can get to other places. That's why, another thing is, so many diseases have to be re-examined. When somebody has gallstones and you take the gallstones out and you look at the gallstones, they're filled with stool species. Now, wait a minute. The gallbladder hooks to the duodenum 24 feet above the colon, where stool species are supposed to be. How did stool microbes get into the gallbladder? You see, all these things have to be re-examined. SIBO, right? Stool microbes like E. coli climbed up 20. When you think about that, JJ, 24 feet for a microscopic creature, that's a pretty big deal.
You started out as a heart surgeon, didn't you? Or as a cardiologist, didn't you?
Cardiologist.
Yeah, cardiologist. Just wanting to point that out to people. And I do love your passion for learning and asking the questions of, well, why? Because that's what I've been asking.
As do you.
Right. Because I want to know, because I want to understand it, because I want to take responsibility for learning and understanding it and thinking about it, which is why from 20 years ago as a personal trainer, I could look at things and go, even like looking at orthopedic surgeons or looking at certain, physical therapists that someone had a knee problem and they were like, they'd go right into the knee. I'm like, but the knee is controlled by the hip and the ankle. The ball joint above and below the knee affect what happens in the middle. If don't go to the knee, but if you don't understand biomechanics and you're just doing pain, then you don't understand how this works. Anyway, so, and again, but that's me always wondering why no one's looking at root causes and everyone's looking at, again, that's what led me to, believe it or not, the emotional conversation, right? Because when you do all the science things and someone still is emotionally, having pain or whatever. So, all right. So let's put this umbrella at, okay, you're beyond the expert in this and much more when it comes to gut stuff. And I'm not going to try to give everybody the crash course in understanding biochemistry at this level with SIBO and SIFO and what happens in the microbiome. But so you're going to get super gut, number one. Okay. And so now I think I want to go to just the differences between, okay, so SIBO is bacteria, SIFO is fungal. Okay. How do they act differently?
Unfortunately, SIFO, small intestinal fungal overgrowth, is not as well characterized, but we do know a few things. So, by the way, we're not trying to eradicate fungi. We're just trying to push back their numbers and push them down from the small bowel, just like in SIBO. Now, it's my belief that if you have the situation where you've allowed fungi to overgrow, SIBO preceded it, or at least dysbiosis preceded it. In other words, bacteria are very good at suppressing fungal proliferation. There are species that are very good at doing that, like Leuconostoc mesenteroides, extremely good. That's a microbe in kimchi and sauerkraut. It's very good at keeping fungal species like Candida albicans and Candida glabrata down. But so how did the fungi proliferate? When you failed to consume fermented foods, when you took an antibiotic and it killed off healthy species, and then fungi. So you have dysbiosis or SIBO, and then fungal proliferation occurs. With pretty good evidence, about a third of people who have SIBO have identified bona fide fungal overgrowth, but I think it's worse than that. The methods to identify are different than SIBO, but here's what I've been doing. The means to eradicate fungal overgrowth are so benign that if you have any of the telltale signs of fungal overgrowth, I would just go ahead and manage it. Telltale signs would be eczema and recurrent skin rashes, as you've pointed out. You could do a stool analysis and count the number of microbes, and that can be helpful sometimes. Sugar cravings, which is very interesting when you think about it, because the food that fungi love is sugar. So no one's identified the metabolite that fungal species produce, but it seems to me what's happening is the fungi produce some metabolite that causes you to crave sugars so that you feed them. So those are pretty clever creatures, even they don't even have brains. But it's an example of how microbes, not just fungi, can take hold of your brain and influence the internal dialogues you have, the thoughts you have, the moods that go, the dream content. So we see this, by the way, a lot in our rotary experience, because that has a big effect on the brain. We have, it affects dream content. I have a weekly meeting on Wednesday night where I meet with about 70 to 100 of my followers. You've been there. And so, it's a very vigorous conversation. And did I tell you about my crazy love dream?
You did. And I think, and I don't even know if you had pressed record yet. I think you told it to me before you pressed record on the, the inner circle.
It's a little embarrassing, JJ. You may remember. So it was a rotary experience because of the oxytocin. Well, I got a hold of a different strain of rotary from a manufacturer. It's a super duper potent one. I made yogurt out of it. Tasted the same. I sleep like a baby now with rotary, even though I'm a chronic insomniac. So I had my usual beautiful 9 hours of sleep. But towards the end of the night, I had this dream where this woman appeared. I didn't know her. She was a stranger, but I could see every detail, her hair, her eye color. And I had this deep affection, this love for this imaginary woman. I wake, she introduces me, first and last name. She gives me her first and last name, which I've never had happen before. I wake up. And what really surprised me was those feelings of deep affection, love, continued well into waking hours for this imaginary person. I've never had that happen before. Well, but it's an example of how these microbes affect your brain. I asked my group a couple of weeks ago, has anybody had an experience like this? People said, not quite like that, but I have a lot of erotic dreams, sometimes with love in it. And in fact, a number of people said they had to back down to every second or third day because they were having too many of them. But it's a great example of the brain.
Bring me back in. Let's talk about that. No, don't. We, Dr. Jabolti Taylor's new book, Whole Brain Living, she came on the show and we talked about, and basically, and I'd love to know how this affects the neurotransmitters that connects to your right feeling brain, because that's where we're all energy, and we're not disconnected. We're all connected, but we don't practice activating those parts of our brain, especially when we're in the left thinking brain of being strategic and linear and all the things that get it done, right? But that's only a part of who we are. Our brain's function is so much greater than that, but we don't access that. And I'd be really curious to see what kind of neurotransmitters get created by this rotary that could possibly create neural pathways to the right feeling brain, even without you trying. And then, of course, because you had that feeling, the oxytocin levels, right, which you can also recreate every day because it became such a cellular flush of endorphins and the circuitry from the brain of the feelings, because feelings are only an interpretation. You're experiencing a feeling because you're seeing something or imagining something or remembering something, and it means something to you. And so Well, again, there's many pathways to get to the same thing, and it depends on which route you're taking. It's like inside out versus outside in, and they're both, valid. It's really like, here's just another tool. If you can't get it from the outside in, maybe let's go inside out. And this would be yours would be an outside in kind of, I'm going to take some yogurt, and maybe the yogurt's going to help with my neurotransmitters and possibly reconnect me to the right feeling brain of my existence that I don't live in very much. And it's going to open up this whole portal of neurons. It's going to have me experience something I don't normally experience. And all of a sudden I'm going to think it's magic. It's not, but it's science. But it also, I think it transports us in a way that the feelings, it's like, I remember when I was a trainer and people would do yoga and they'd be like, it's like magic. I lost weight. I'm like, you lost weight doing yoga because you stopped overthinking. You started breathing. You decreased your adrenal fatigue. Like, here's why yoga was, you were calmer. You weren't overeating to put down the anxiety. Here are the 10 reasons why yoga, I'm not saying it was not amazing, but the response that type A people would have in a yoga class was literally transferring from one part of the brain to the other. And then their whole body started to relax. And in which case they didn't need to feed their face to not stress themselves, and they lost weight. Ooh, that's magic. So back to this conversation about the gut, because the gut does create all of this. The gut helps with all of this stuff. And it is. And I think you said that there was a discovery in 2007 by who doctors in what country that sort of feels like where I just want to go for a second to let people know that your, cardiology turned slightly to, oh, I'm gonna look at food. Oh, look at this. This works. Oh my God. Holy shit. What is this? Like, I just discovered the fountain of youth and of all disease basically in the modern world. Yes. I'm not exaggerating. Am I?
No, you're exactly right, JJ. This is an entire universe of new findings, new insights, just with oxytocin, there's good evidence, 5 studies now, that people who attempt suicide have 50% lower levels of oxytocin. So we have a study planned where we want to sequence the microbiome of people who have attempted suicide, see if they have rotary or not, and also look at their levels of oxytocin. And then, should this all proceed, what if we can intervene in some way? What if we restore rotary, boost their oxytocin? Can we reduce suicidal ideation? You're right. The microbiome has, just in the world of neurotransmitters. So you can make Lactobacillus plantarum yogurt, for instance. I did this the other day, and it gives you acetylcholine. You can take the microbe Lactobacillus brevis, which is also a fermenting microbe you find in kimchi and sauerkraut sometimes. And I made yogurt out of that because it produces what's called phenylethylamine, which is amphetamine-like. It's a stimulant, and it lifts your mood up, and it's a nootropic. Makes you a little smarter, a little more clever for a few hours. So there's ones that produce epinephrine, norepinephrine. One I'd really like to understand better is dopamine. We don't have a good handle on ways to not playing with dopamine is a little bit hazardous, because dopamine is also the
dopey,
of course, of addiction.
Too much. Yeah. Too much in your.
I'd like to also know, I have a friend who's been married to the same woman for 43 years, and he feels like she's lost the spark of their relationship. He has not. He wants to rekindle it. Well, imagine we could turn that feeling on again with rotary or whatever else is required. So I'm wondering if it's rotary with something that augments dopamine intermittently. I think we're getting close to being able to turn on and turn off the feelings of affection and love, as well as empathy.
Okay. Well, I want to be part of that study, especially with the suicide. I want to do 2 groups. Once you get your information, let's take them and go, cut them in half, and let me, just like with you and your dream, help them cultivate the focal point, the focus, the awareness that they're focused on that scenario, and the replaying of that and the visualization of that and the embodiment of that will maintain a positive momentum with or without. I'm not trying to get rid of the yogurt, but I'm just saying it will help the positive momentum, so that way, because I don't know if I talked about this in your inner circle or somewhere I talked about this, that with when I had the fibroid stuff and my hemoglobin was really, really low, and everyone's like, oh, you're going to feel so much better. You're going to feel like so much more energy. And the way I live, not to mention my astrological composition, but the way that I live made it so much that I didn't realize or have the same response other people would in the same condition. right? So at 7.2 hemoglobin, when the bottom is 11.5, by regular standards, I should have been super lethargic, not, very depressed, not motivated. I was none of those things. I was no different than I normally am. But I think that part of that is astrological, energetic blueprint of who I am. But I think the other part of that is how I choose to live, how I choose to see things, the practices that I do. So I'd love to get involved just to take that also to the next level, because I think, again, I don't care if it's inside out, outside in, however you experience it, then it becomes your responsibility to take it and run with it and keep going with it. And then how do we collectively get it all firing at the same time? So it's not just, oh, I need my yogurt, because then that could become an addiction. Oh, if I don't have my yogurt, then I can't be happy. Okay, yes, and like, get the good stuff. We don't want to be addicted to just one way. We want it all to work together. So as I digress, going back to this conversation about microbes and SIFO and SIBO and leaky gut, and just assuming that everyone's got some bit of a problem. Everyone has some bit of a problem. And if you want to know more about what the problem is and how it started and how to deal with it, please buy Super Gut. That's Dr. Davis's newest book. And he has a 4-week program in there. Can we spend a little time talking about the overview of what to expect from this 4-week program? And if you want some support, Dr. Davis has invited me to speak to his, what is it now? Infinite Health, Dr. Davis, Infinite Health Inner Circle. Mm-hmm. And that, like my Inner Circle membership, is a community of people who want to learn together, keep each other accountable. But then you also have access to Dr. Davis, because he doesn't do any one-on-one. So you're never going to see him one-on-one. You can't hire him. Well, you probably could, depending on what the price is and what it's for. Like, we're talking top dollar. But let's just assume if you want his time, attention, or him to answer a question, you're going to join his Dr. Davis Infinite Health Inner Circle, and you're going to get the book, and then you're going to come and you're going to do this program. So tell us about this 4-week program, to what people can expect, how they're going to, obviously what I think anyone and everyone could use it. I mean, I don't have symptoms that are crazy, but I'm sure I do have symptoms, and I'm sure I could get better at, my gut too. We all could. So tell me about it.
Well, I draw the analogy, JJ, that your microbiome, your intestinal microbiome, is just like a backyard garden. So if it's springtime, you're going to plant a garden, you prepare the soil, you pick out the stones and the weeds, and then you plant seeds, and then you water and fertilize it through the growing season. Well, the microbiome is almost exactly the same. You prepare the soil, that is, you take things out of your life that have been disrupting your microbiome. You minimize antibiotics, herbicide, pesticide residues, so you get organic food. Go for whole foods that don't have emulsifiers and other additives. And then you plant seeds. The most important seeds are fermented foods. Probiotics, commercial probiotics, are still kind of primitive. They're getting better. But there's a listing of the ones I would recommend that contain keystone species. These are more effective. And then you water and fertilize are just the fibers, the prebiotic fibers, polysaccharides, and polyphenols that are in foods like onions, garlic, alliums, legumes, root vegetables, etc. Now, the problem with this is the program won't work if you start with SIBO and SIFO. So this program will work wonderfully if you have just mild dysbiosis, not raging dysbiosis, but if you have SIBO, SIFO, you've got to address that first, or nothing you do in the list of basic things will work. So I list telltale signs such as fat malabsorption, unremitting skin rashes, depression that won't respond to anything, like antidepressants, is clearly SIBO and endotoxemia, by the way. One of the things I've been doing lately is, so you could go to your gastroenterologist, and if he actually knew what SIBO was, he'll prescribe an antibiotic. You could go to your naturopath or your functional medicine doctor, and they'll probably give you herbal antibiotics, only 2 of which have any evidence for efficacy. And we have used, they do work well. The Kendibactin and the FC-Cytal and dysbiocide regimens do work pretty well. But I've been doing something different lately. It's preliminary, but so far I think it works. And that is, so if you have SIBO, 30 feet of unhealthy stool microbes inhabiting your entire GI tract and is causing all kinds of health problems for you, and if you take a probiotic, will the SIBO go away? No. It might reduce bloating, might cut back on the diarrhea, but it will not get rid of your SIBO. And no surprise, commercial probiotics are just haphazard collections of microbes. So I asked some different questions. I asked, what if we chose microbes that colonize the upper GI tract where SIBO occurs, and choose species that produce what are called bacteriocins? those are natural antibiotics that are effective against a species of SIBO, like E. coli and Klebsiella. So I chose 3. And I chose a strain of Lactobacillus gasseri, our old friend Lactobacillus reuteri, and Bacillus coagulans. Gasseri and reuteri in particular colonize the upper GI tract, and the gasseri is a bacteriocin powerhouse, 7 bacteriocins. The reuteri produces up to 4. So we co-ferment yogurt. We make yogurt to increase the numbers of bacteria. And we ferment for a long time, 36 hours, to get really high, hundreds of billions of counts. And then people consume the yogurt. And preliminary, JJ, but so far of 30 or so people, 90% have normalized their hydrogen gas, which you say, not only 90%, well, the best they have in conventional medicine is rifaximin, the antibiotic. It's 40 to 60% effective. So if we're getting 90% with this, what I call SIBO yogurt, so I'm very hopeful this continues. We will look at this more formally in a trial down the road. We've got too much on our plate already in the next couple of years. Down the road, we'll probably do that, not as yogurt, by the way, but as microbes. You can't use yogurt in a study and control for all the variables. But I'm very hopeful that we have a means by which you can just make stinking yogurt and get rid of your SIBO.
Okay, so back to that very first conversation we had on Wheat Belly. That was our first conversation, and you talked about the yogurt, and I bought all the things. And but the thing is, I don't do dairy, so I found your coconut yogurt, and I think out of the 3 or 4 times I did it, it worked once to make it kind of edible. It worked. I mean, I could chew on it. I got too hard on one of them, and which doesn't seem possible. But what advice? And then one of the nutritionists that I work with, she actually gave me what I found was really easy, and it's not going to be the right thing completely, because I know when you said reuteri needs 110, 105, 105 or 100 degrees. What was reuteri?
Human body temperature. So about 97 to 100 degrees.
Okay. Well, she gave me, but they were dairy based, a starter basically. And I put a scoop or 2 in with some coconut milk or almond milk. I did different kinds of milks, and then I just left it on the counter for like days. And it would be yogurt. And I did do that, but I don't know all the strands that were in it. And I don't know how much reuteri I got, and it did work. But, and then I got the stick thing, and I got the one with little containers. Like I got all the things you mentioned, I literally bought after that first show, obviously, because this one's still sitting on my desk. But I did use the yogurt one. So what would be because a lot of people who do listen to my show and watch are not necessarily doing dairy. And I love to support them in that. Is coconut milk okay to use, or coconut cream, or is there a better nut milk or vegan milk that's better than, I mean, even if it's oat, I mean, oat has more sugar in it, but that could mean it could ferment faster. I don't know. Which yogurt would be, which other milk?
One good choice is coconut milk or coconut cream, but you have to make sure there's no additives,
right?
Except for guar gum. Guar gum's okay. And then there's several additional steps if you're going to make the coconut milk yogurt. So what you have to do is you have to we don't preheat our dairy, because they do that in commercial yogurt making, because they're using skim milk or low fat, and the preheating improves the mouthfeel. We don't have to do that. We're starting with 18% fat in half and half. But when you use coconut milk, you do have to preheat. We preheat to about 180 briefly, let it cool down to warm, mix in your prebiotic fiber, put in about 3/4 teaspoon of guar gum, and then hit it with a stick blender.
Okay.
And blend for a minimum of a minute till it becomes a thickness of heavy cream. Then add your microbes. Okay. So those 2 extra steps, the guar gum and the blending, keeps it from separating, because you probably saw how coconut milk loves to separate. It becomes inedible. So you have those 2 steps inhibit separation. Now, you can ferment other things. I will tell you, dairy is the most forgiving, but you can ferment other things. I've got some hummus being fermented on my counter right now. I'm fermenting some Bacillus subtilis. You can ferment pureed fruit. I've got some apple cider fermenting. You can ferment all kinds of things. They won't give you the same high counts as dairy does, but you can still do quite well with those other things.
We did back when Fit to Love was my main show and I was doing video and audio. Jeannie and I did fermented vegetables. So but we didn't add, we think we only added salt and we let it naturally ferment. We didn't add any extra starter to it. But so how would we do? And that was great because these were still crunchy. We used carrots and cucumber and radishes, and we did all kinds of fermented vegetables, which ends up being a great snack. It's tasty. And I drink, kraut juice. I eat sauerkraut. I will be doing it more, but I have been doing it on a regular basis. I have ginger that has been fermented that I eat, but I really do want to do the yogurt. It's just that I've tried it a couple of times and I'm trying to find my groove with it. And so the next question I have for you is, because I did follow your recipe and there was a time that it did work exactly the way that I thought it should. I don't know what happened the other two times because I do have all the things you tell everybody to buy and I did do all these steps. But it's adding, I'm not going to eat it plain. So when can you add in the stevia and the vanilla? Because I'm not going to eat it plain. So
you can add those things at time of consumption. I had blueberries, I had chia seeds, whatever seeds or nuts you want to add. You can add all kinds of things to it.
But don't add it before because will that affect its growth?
You can add a lot of things before, but you have to be careful. Some things have antibiotic properties and you don't want to add something that kills your microbes. Like a mistake would be, I can't imagine you'd add it, but cinnamon has antimicrobial properties. Okay. So, but beyond that, you can add things ahead of time.
I added vanilla and stevia, but it didn't seem to, I couldn't tell if that was, because I didn't know when to add it after the fact. Because again, I want to have it taste good. And I'm not eating a ton of fruit right now. And I'm fasting a lot. That's the other thing. So for people that are fasting, it's well, when do I put it in? Like you were talking about this air device. So let's just address this for a quick second. So like today, I did have a bulletproof coffee this morning. So there was literally, I had a little bit of sugar alcohol in it. There was a little bit of stevia and a little bit of Swerve brown sugar. There was cinnamon. There was vanilla, butter, and coconut oil. And that's all I had. And that's all I'm going to have until dinner. So now would be a good time. And that was several hours ago. I've done an hour hike since then. I've had glasses of water. So would now be a good time for me to set this up? Would this be a good base?
You can find out just by doing it. If you have a low value, let's say 1.3, you're good to go. The problem comes if you had something that was feeding bacteria and it got to your colon and you blow and you get, let's say, a 10. You can't test it because you're looking for a change of 4 between 0 and 10. If you start at 10, you can't, So you want to set yourself up to have a low value at the start. That's all you're doing.
So if, let's say, possibly the brown sugar Swerve could have created some sugar for me and up my number, what would be, if I'm fasting, what would be a good time to, how many hours would I need to go to, do you think that might sort of dissipate so that I could get a better reading?
Usually 12. Swerve contained inulin. So in other words, you ate something, it went down through the small bowel, 24 feet, then got to your colon. The colon microbes can produce hydrogen gas, but that's normal. But if that's a situation and you blow a 10 or a 9.7, well, you can't test because you're getting the interference from the colon.
Got it. Okay. All right. Well, I'll test just to see what's going on. And then if it is, I could possibly, it could be the Swerve. I don't use it every day, but, and then I could just wait and do it tomorrow because I'll be fasting again tomorrow and I'll just not do the Swerve or do it before I have my coffee. One of the two. So, okay. All right. I'm going to use this device. I bought it whenever we had our first conversation, for crying out loud. It's been sitting on my desk. All right. So I'm convinced I'm going to use it. I at least want to try it. Supergut is amazing. Everybody, please make sure you get your hands on this because it probably is the secret to whatever is going on with you that you haven't been able to figure out and your doctors don't know what to tell you and you've given up and you're frustrated. Since that sounds like that is basically what the whole program, Dr. Davis's whole entire career has led him to, this breakthrough in health in a new way, to all the things that you're not going to hear from probably a lot of other people, except maybe on this show and on his show. Again, Defiant Health. Make sure you follow Defiant Health Podcast. Get the book, Supergut, and check out in the show notes. I will have the link for Dr. Davis Infinite Health Inner Circle, so that you can join his Inner Circle community. And weekly, he does a Wednesday night. And yeah, I remember when you said to me, and I felt badly because I thought, oh, did I make him stay longer than he wanted to stay? Because you had told me, oh, sometimes it's an hour, sometimes it's 2 hours. I was like, cool, I'll stay for 2 hours because I love talking about this stuff. Like you love talking about this. I love talking about the emotions and how they affect
they loved
the body.
having you on. I got great feedback on that evening, JJ. So they appreciated it.
Good. Well, I'm glad. I need to just write the damn book. I know it's this year. I have to write that book so that I can just say, read the book, and I don't have to spend 3 hours talking to everybody about it, which is fine. I love doing it. So everybody get Super Gut, please. Again, if you heard any of the symptoms that were mentioned today that you have or someone you know has who has not found relief yet, it is your gut. And hopefully people will be open to exploring that and doing something about it. Dr. Davis, it's always a pleasure. I'm going to have to figure out another way, what else we're going to talk about to have you come back, because this can't be the last conversation that we have. So thank you so much for coming back on the show. And I know everybody's going to get this.
Pleasure's mine.